Hi, I'm Dr. Rob McNab, owner of McNab Wellness here in Joplin, Missouri. Today I wanted to talk a little bit about healthcare and why my practice is so different from a typical doctor's office. Every year we see headlines about health insurance premiums rising. Deductibles climb higher, copays increase, and yet at the same time, access to meaningful healthcare just continues to shrink. So patients are paying more than ever for insurance while receiving less care than they need. And with current changes in the health insurance arena, those costs are about to increase substantially for many of us. Now, health insurance is supposed to protect us from catastrophic healthcare costs. It's not supposed to be a catastrophic healthcare cost. I hear this sort of thing daily from my patients. I have insurance, can't afford to use it. I pay thousands of dollars a year, and I'm still waiting to get in to see a specialist. Right now in America, healthcare requires a new approach, one that protects both our health and our pocketbook. And that's why at McNab Wellness, we take a lifestyle medicine and direct primary care approach. Proactive care that reduces costs long before illnesses become expensive. Now, we've all heard an ounce of prevention is worth a pound of cure, right? And we know that about 70 to 80% of chronic diseases, they're driven by lifestyle. It's the nutrition, it's our movement, sleep, stress, social support. When we address these things early and consistently, we dramatically reduce the need for costly medications, procedures, even hospitalizations. Walking shoes cost a lot less than heart surgery, right? So lifestyle medicine is not just good for health, it's one of the most powerful cost containment strategies in modern healthcare. And it works best in a system that allows time, access, and relationship. And that's what direct primary care delivers. They say you work for who pays you, right? Well, that's the core problem with health insurance. What your doctor can prescribe. How many patients do they have to see? How much time do they get to spend with a patient? All of those things are being impacted by your insurance provider. And there's a lot of people that you and I don't know that interfere with your relationship with your doctor. Direct primary care is a solution to that problem. Get rid of the middleman. So instead of navigating copays, deductibles, surprise bills, patients pay one predictable monthly membership for unlimited primary care. In the direct primary care model, it removes financial barriers to getting early help. It allows for longer visits so you can get to the root of your problem. You can prioritize prevention over late-stage intervention, and it includes good direct communication in real time with your providers. So when you can talk to your doctor before problems escalate, we can avoid a lot of unnecessary costs for you and the system. So rush 15-minute appointments just simply can't deliver lifestyle-based, relationship-centered care. So in direct primary care, I work with patients on personalized plans that change their disease trajectories, putting chronic diseases into remission, decreasing the need for medications, improving mental well-being, better mobility and reduced pain, long-term independence and vitality. This isn't wishful thinking. This is proven evidence-based medicine that requires time and follow-through, both of which a direct primary care can provide better. One major difference from other practices at McNab Wellness, my practice is capped at 300 patients. Why is that? Having true accessibility just can't exist in a system where your doctor is responsible for 2,000 or 3,000 patients. A smaller panel ensures same day, next day visits, longer visits, a doctor who actually knows you and your story and your challenges. It can offer true partnership and health change. When we promise availability, we honor it. Health insurance premiums are going to continue to rise. That trend just seems clear. But paying more doesn't seem to guarantee that you get better health. A better model is one where care is accessible, where prevention is prioritized. The focus is on living well, not simply reacting to illness. In my opinion, direct primary care and lifestyle medicine isn't just a different payment model, it's a better care model. One that gives people the opportunity to be healthier, happier, and more engaged in their own lives. At McNab Wellness, we believe your health shouldn't depend on insurance policies. It should depend on a relationship with the doctor who has the time and freedom to help you thrive. And we're proud to be offering that path right now, right here. So best wishes to you on your health journey in 2026. If you have any questions, always feel free to reach out. I'm always available.